My name is Amber Ray, and I'll be presenting on the hepatitis C virus. There are three types of hepatitis, hepatitis A, hepatitis B, and hepatitis C. Each type has its own genetic makeup. Hepatitis A and B can cause inflammation of the liver, and hepatitis A and B also have vaccines, but hepatitis C does not. Hepatitis C is going to be the primary focus of this video. You can see in the picture there is a liver that is taken through three stages. It goes through the healthy stage. The stage in the middle is the liver infected with hepatitis, and the far right, hepatitis is advanced and has developed into liver cancer. So what is hepatitis C? It's a contagious disease, and it can result in serious liver damage over time. An individual can be infected for years without feeling symptoms or even knowing that they're infected. By that time, the symptoms that occur is often a sign that the liver damage is so advanced. The picture is a model of the human hepatitis C virus. It's just a virus cell, and it shows each individual, breaks it down into each part there. So how is hepatitis C transmitted? The blood of an infected individual must enter the bloodstream of an uninfected individual. Just some risks to be aware of for everyday life. Sharing personal care items such as razors, toothbrushes, things like that. Needle stick injuries in healthcare settings. Sexual contact with an infected individual, or getting a tattoo with unsterilized equipment. Also, you can add using recreational drugs injected through a needle. Factors that increase infection rate. There are just certain factors that can increase certain individuals' chances, like being born to a mother who has hepatitis C, having AIDS or HIV, having symptoms of liver disease, or long-term kidney dialysis. Basically, the poorer the immune system is, the less resistant the body is to infection. There are a lot of symptoms to hepatitis C. Fever, loss of appetite, stomach pain, vomiting, tiredness, urine that is dark colored, gray colored stool, yellowish eyes and skin, or joint pain. As you can see in the picture, the whites of his eyes are all yellow, and you can tell the difference in the skin tone between the normal and the jaundice colored. So how is hepatitis C diagnosed? There are two blood tests that are administered, the antibody test and the viral load test. The antibody test will show if you have been exposed to the virus, and the viral load test will tell if the virus is present in the bloodstream and how much is present. For the slogan at the bottom, it says over 5 million Americans are infected with the hepatitis C virus, but 75% of those infected remain undiagnosed. Percentages are so high just because the symptoms can go unnoticed for many years, and until the liver is too damaged and can't continue to mask the symptoms anymore, then you'll appear as a healthy individual. Liver damage. Knowing how damaged the liver is will help to determine the best course of treatment. This result is known as your fibrosis score. There are three methods to measuring the liver damage: blood test, ultrasound, and liver biopsy. And there are 5 stages to classify the damage. F0 is no damage. F1 is mild fibrosis, which would mean early stages of damage and then minimal scarring. F2 is moderate fibrosis, which would concern scar tissue is starting to form here. F3 is severe fibrosis, meaning blood flow in the liver is affected. And F4 is cirrhosis, which leaves a lot of scar tissue and the liver starts to not work properly. In the picture, you can see the course of illness for the liver. The cure rate is higher for patients with acute hepatitis, and once the inflammation and infection becomes too advanced, it's hard to reverse the damage. There are 6 types of hepatitis C genotypes. Each one is unique in its own genetic makeup. Genotype 1 is the most common type for the United States, and treatments are available for all types. Once the damage is assessed, basically the specialist will find out which type that you have and develop a treatment plan from there. This diagram shows the natural history of hepatitis C. First, the infection will enter the bloodstream and work its way to the liver. Over the course of several years, the diagram shows 12 to 20 years. The hepatitis infection progresses from acute stage. During this acute stage, it just basically means the patient is more than likely to have small flare-ups of the symptoms and every once in a while, and are only contagious for a small amount of time, normally lasting a few months. This is the prime stage for beginning medication to get rid of the infection. If the infection continues long enough, it can develop into chronic hepatitis, meaning the infection has stayed in the body and has started to affect the liver. For the diagram, the patient starts to show signs of chronic hepatitis around the 20-year mark, and so at this point the infection advances to one or two things. Cirrhosis of the liver develops, or the liver damage has advanced too quickly and has skipped cirrhosis and led straight to liver cancer. Where you see those red blinking X's on the screen, that's where the doctor will try to use cell therapy and to reverse or try to slow down the damage. After about 3 to 6 years of battling cirrhosis or cancer, death will occur if the medication or cell therapy does not work. So treatment. Hepatitis C is treated with a variety of antiviral medicines. I put two pictures at the bottom, pegentiferin and ribavirin. These medicines just basically stop or slow down the growth of the virus. Treatment is basically dependent on how damaged the liver is, how much of the infection is in the body, and also genotype that is present. The medicine is often expensive, and sometimes it doesn't work for everyone. Hepatitis C is a curable virus, and with this medicine, but it depends on prognosis and how far along, like I said. Yeah. And that is all that I have on the hepatitis C virus. Dr. Blair, you can use this video if you would like.